about the larynx, the cartilages and the membranes and the ligaments. Now third topic is the muscles of the larynx. So muscles of the larynx, they are the intrinsic muscles. The definition of the intrinsic muscle is that the muscles which take origin and insertion within the larynx. Same as we have done in the tongue, intrinsic muscle of the tongue and the extrinsic muscle. So all the muscles of the larynx, they are intrinsic. And the names of the muscles, they are suggestive. The name will tell their origin as well as the insertion. The first muscle is the epiglotticus. Epiglotticus muscle. So name is, it takes origin from the arytenoid cartilage, and epiglottis means it is attached to the epiglottis. So this is the epiglottis, the lateral border, to which the quadrangular membrane is attached, which forms the laryngeal inlet. So this is the arytenoid cartilage. So epiglottis. So quadrangular membrane, the other name of the quadrangular membrane is epiglottic membrane. So in its upper border, upper free border of the quadrangular membrane, it contains a muscle which is between the epiglottis and the apex of the arytenoid cartilage. So this muscle is called the epiglotticus, name of the muscle. And in the upper free border, it becomes thickened, and this thickened part is called the epiglottic fold. So this is a fold of the quadrangular or the upper border of the quadrangular membrane. So what will be the action of this muscle? Origin, insertion. So whenever this muscle will contract, what will happen? The two folds of the quadrangular membrane, they approximate, and it is closed whenever any foreign body try to enter into our respiratory tract, because here internally it is lined by the ciliated columnar epithelium. So when the particle come in contact with cilia, so whole of the mucous membrane along with the underlying muscle is stimulated, and this brings about the closure. The upper part of the epiglottis is called lid of the larynx, but it doesn't act as a lid, because experimentally it has been found that if we have cut this upper part of the epiglottis in experimental animals, even then the laryngeal inlet closes. So this signifies that it is not the part. The another muscle is the thyroarytenoideus. Thyroarytenoideus. Name is suggested, from the thyroid cartilage to the arytenoid cartilage. So this is the inner surface of the lamina of the thyroid cartilage. So just below the epiglottic muscle, from the inner surface of the lamina of the thyroid cartilage, another muscle fibers are also going to the quadrangular membrane, inside the quadrangular membrane. So these muscles, they are called the thyroepiglottic. So their name is the thyroepiglottic. The contraction of the thyroepiglottic muscle also help in the closure of the laryngeal inlet. So that is the function. Then the third muscle is called the cricothyroid. So this is the cricothyroid muscle, is the outer muscle, cricothyroid. So this muscle takes origin, this is a fan shaped muscle, the hand fan shaped muscle. So it takes origin from the anterior or the lateral part of the arc of the cricoid cartilage, and it has got two parts. The anterior part of this muscle fibers, they are almost straight. This straight part of this muscle is called the pars recta. Recta in the anatomy comes wherever there are straight. As we have done in the suboccipital tracheal, rectus, capitis, major and minor, so they were straight. So this is the straight fibers are called the recta, and the posterior fibers, they are oblique. They are called the pars obliqua. Pars obliqua. So this is the origin, and insertion is on the lower border of the thyroid lamina. So what will be the action? So whenever the muscle will contract, cricoid cartilage is fixed with the trachea. Which cartilage will move? Thyroid cartilage. In which direction? Anterior. Because they are obliquely, so this thyroid cartilage will move anteriorly. And we know from the thyroid cartilage, in the lower part of the thyroid cartilage, from the inner surface is attached the vocal cords. Two vocal cords are there, which is the medial free border of cricovocal membrane. So we can see inside there are two folds are present. The medial free end of the cricovocal membrane, which is called the vocal cords or the vocal folds, are there. So when the thyroid cartilage moves forward, anterior end of these vocal cords, they are attached to the thyroid cartilage. So when the thyroid moves forward, so the elastic vocal cords, they will also increase in length. That is called the, what is the action? Elongation of the vocal cords. That is the action. Elongation, and the vocal cord, they also becomes tense. So it also called the tension or the lengthening of the vocal cords or the vocal fold is the action of cricothyroid muscle. So this is required during the resonance of the voice. So that is the action of cricothyroid muscle. Another muscle deep to this is the lateral cricoarytenoid, yes. Arytenoid, yes. So this lateral cricoarytenoid muscle, this is the conus elasticus between the thyroid and the cricoid cartilage, and this is the superior border of the cricoid cartilage. It has got two lips, inner lip and the outer lip. Inner lip, we have seen that it is attachment of the cricovocal membrane. The outer lip, from the outer lip, the muscle taken is called the lateral cricoarytenoid, yes. Lateral cricoarytenoid. And here is the vocal process of the arytenoid. This is the apex of the cricoid cartilage arytenoid. This is the base of the arytenoid. And laterally, this is the muscular process. This is the vocal process. And from the vocal process is attached the vocal cords. And here attached to the atlas, thyroid. So this muscle taken from the outer lip of the cricoid cartilage, and this muscle goes upward, backward and medially, and it passes below the posterior arched inferior border of the thyroid cartilage, and from here this muscle go and attach to the muscular process of the arytenoid cartilage present near the base. This is the question. So this is the lateral cricoarytenoid muscle, lateral one. From lateral surface it takes origin. So what will be the action? So whenever this muscle will contract, cricoid is fixed. What will move? Muscular process of the arytenoid cartilage. In which direction it will move? It will move laterally. And it is arytenoid cartilage is attached to the vocal cords. So how we show the action of this muscle? So this is the thyroid cartilage. This is the thyroid cartilage. And to this is attached the two vocal cords. And posteriorly the vocal cord is attached to the vocal process of the arytenoid cartilage. And this is the medial part, and this is the lateral part of the base of the arytenoid cartilage. So this is how we show the action of the muscles of the larynx, which moves the vocal cord, because vocal cords are vocal. Vocal means they are concerned with the voice production. And voice production is process is called phonation. Phonation means as you give the phone. So remember, phonation means sound production. So the gap between the two vocal cords is called the rima glottidis. This is called the rima glottidis. So the vibration of these vocal cords, they produces this sound. When the expired air from the lungs, due to increased intracranial and intrathoracic pressure during the diaphragm moves up. With the diaphragm moves up during the expiration, the lungs volume decreases. Lung is squeezed and CO2 goes out. And when this CO2 from the lungs passes through the trachea, then they pass through the vocal cord, which are lying below. The vestibular fold of the quadrangular membrane lies above. So when they pass through the vocal cords, they vibrate, and this vibration produces this sound. So during voice production or the phonation, the vocal cords becomes very, very close together, and the closing or the coming together is called adduction movement. So there are 4 movements done by these muscles. One is called adduction, second is called abduction, third is called tension, fourth is called relaxation. Tension is also called lengthening of cords, and relaxation is called shortening of the vocal cords. All are vocal cord movements, because the vestibular fold, which are the lower end of the quadrangular membrane, is widely separated already, because that is made for the respiration, inspiration as well as the expiration. But the vocal cord is for both the purposes. Adduction causes the phonation and abduction causes the respiration. So that is the action. And both adduction and abduction, they cause mainly due to the rotational movement, and very less the sliding movement of the vocal cords. And the lengthening and shortening, it is mainly due to the sliding movement. No rotational movement is present in these. So there are 4 movements of these vocal cords are important. So whenever these muscles they contract, so this gap between 2 vocal cords has got 2 parts. The anterior part, that is the vocal ligament, and the vocal fold is called membranous part. It is about 3/5. And this last part, this much, between the 2 arytenoid cartilage, the vocal processes, plus this whole of the area, this is only about 2/5, is called the cartilaginous part of the rima glottidis. Has got 2 parts. membranous part anteriorly and cartilaginous part posteriorly, which is very small. So this lateral cricoid muscles, when they contract, so this is the lateral insertion is here, this is the insertion here. So whenever this muscle contracts, lateral cricoid, so what happens? The muscular process moves in which direction? When they contract, where they move? Forward and laterally. Forward and laterally. And where this vocal process will move? Medially. Is it possible? So the vocal process will move. And what will happen to these vocal cords? They are closer. So what will be the action of this muscle? Adduction. Because vocal cords, they are coming closer. So this happens during the voice production. They become very, very close. And sound is produced, but it is of low pitch. As occurs during what you call whispering. Whispering. So this muscle is also called the whispering muscle, in which the vocal cords becomes very, very close together. So this is how to explain. So it is a very, only one question of the larynx is very difficult and frequently asked is this, muscles of the larynx. There are about 10 muscles you have to write, short note here. With origin, insertion, and you have to remember action. The fifth muscle is the, names are suggestive, all the muscles, only one muscle, that is cricothyroid, is anteriorly. Rest of all the muscles are seen from backside. And deep to this cricothyroid is the lateral cricothyroid. All other muscles you can see from behind. One is the trachealis. As we have seen, that trachea is articulated, the first cartilaginous ring with the cricoid, then subsequently the other. Because posteriorly there is no cartilage, so there is a muscle that is called trachealis. Another muscle is the vocalis. As the name suggests, so it is related to the vocal cords. So vocalis muscle lies just parallel and lateral to the vocal cords, or what is called the vocal ligament. Vocalis. So this muscle takes origin from the thyroid cartilage. It moves parallel and lateral to the vocal ligament and inserted on the lateral surface of the vocal process. This is the lateral surface of vocal process. Origin, insertion. Vocalis muscle. So what will be the action? So whenever this muscle will contract, origin structure doesn't move. What is moving? Insertion. Insertion is on the vocal process of the arytenoid cartilage. So when it will contract, so where the cartilage will move? In which direction? Forward direction. So when it moves forward direction, what will happen? The vocal cords, they becomes smaller or length? Smaller. So what is the action? Relaxation or shortening of the vocal. When it is required? During production of resonance of the voice. So that is, you have to write the action, the shortening of the cords. The another muscle is the phyroarytenoideus. Like quadrangular membrane, in the cricovocal membrane is also embedded the muscle that is called the thyroarytenoideus. So name is suggested, it takes origin from the thyroid cartilage. So as we know, this is whole is the thyroid membrane. So within this thyroid membrane is embedded the vocalis muscle, and lateral to it takes origin from the thyroid lamina, and this muscle is inserted over the muscular process of the arytenoid cartilage near the base. Plus, it is also fused with this black membrane. This is the cricoarytenoideus ligament joint. So the joint between the arytenoid and the cricoid lamina, there is this is joint, slightly movable synovial joint is there. So fibrous capsule is there. So this muscle is also attached to the fibrous capsule. Or in the other words, whole of the cricovocal membrane, like the quadrangular membrane, is having muscle. Same is here. And it is said that this vocalis muscle is nothing but this is the condensed and thickened fibers of few medialmost fibers of the muscle thyroarytenoideus. It forms the vocalis muscle. So action is also same. Both the muscles, what they do? Relaxation of the or shortening of the vocal cords during resonance of the voice production. So that is the action. Another muscle we see here is this. This is called the safety muscle of the larynx. Posterior cricoarytenoideus. Posterior cricoarytenoideus. So this muscle takes origin from the fossa, which lies lateral to the median ridge on the posterior surface of the lamina of the cricoid cartilage. This median, this is a ridge, raised area of the cricoid cartilage posterior surface. Just lateral to it there is a depression or fossa is there. From that fossa, this muscle takes origin is the posterior cricoarytenoideus. This median ridge will give rise to the insertion of the tendon of the esophagus. The esophagus has got outer longitudinal smooth muscles and inner circular smooth muscles. So, anterior surface of the esophagus, these longitudinal muscles, they get condensed and they move upward and they form a finger thickness tendon which is inserted on the median ridge of the cricoid cartilage. So it will anchor the esophagus indirectly to the larynx or to this median ridge that is called the tendon of esophagus, formed by the outer longitudinal muscular cord. So this posterior is called the safety muscle of the larynx. Why safety we will do later on. So this muscle has got two fibers. The upper fibers, they are almost straight or vertical. The lateral or the lower fibers, they are oblique. And origin is very long, but the insertion is converted into a very narrow tendon. And this very narrow tendon of this muscle is inserted on the muscular process of the arytenoid cartilage. Muscular process. So that is the muscle that is called posterior cricoarytenoideus muscle. Posterior cricoarytenoideus muscle. So what will be the action? So whenever this muscle will contract, what will happen to the muscular process? Where it will go? they will move medially, because this is the rotational movement. The base of the arytenoid cartilage, it moves on the upper border of the lamina of the cricoid cartilage. So due to the external contraction of this muscle, the muscular process rotates medially. So both the ends posteriorly, they move medially. When they move medially, the muscular process, where the vocal process will move? If they move like this, medially, then the vocal process will move laterally. Is it clear? So this is the rotational movement. And what will happen to the vocal cords? They will move away from each other. That is called abduction. So that is the action of, this is the abduction. So abduction movement, when it is required, so abduction movement is required during respiration. So vocal cords should go as far away from each other, so that more and more oxygen should go during inspiration and more CO2 goes out. So that is the purpose. So, and if this muscle is paralyzed, see what is strong muscle, a very large fossa, two type of the fibers, and a very strong tendon, and mainly action is the abduction. So if this muscle is paralyzed, what will happen? The adductor muscles will supervene and they will close the laryngeal glottis, rima glottidis, and patient will die. Death will be there because they are paralysis. The nerve supply is gone. So that's why it is called the safety muscle of the larynx. That is called posterior cricoarytenoideus. Then another muscle, two more muscles are seen here. One is the transversely running fibers. Can you see here? Transversely running fiber from one arytenoid surface, posterior surface, to the another surface. So because of the horizontal fibers, it is called the transverse arytenoideus. So names are suggestive, they are telling which type of fibers. Transverse interarytenoideus. Because it is present transversely from right to left. So what will be the action? So when this muscle will contract, the two arytenoid cartilage becomes closer. And when the two comes closer, what will happen to the vocal process and vocal cord attached to them? They also becomes closer. What is this action is called? Adduction. So action is the adduction. The last muscle is the oblique interarytenoideus. So you can see these crossing muscle fibers. So crossing muscle fibers, they are called the oblique interarytenoideus. So these muscles, they take origin from the muscular process of the one arytenoid cartilage. They move upward and laterally and inserted over the apex of opposite arytenoid and vice versa. So they cross in the midline. So they are called the oblique interarytenoideus. So action, what will be the action? So whenever these muscles will contract, what will happen? The apex will come closer and vocal process also comes closer. Again, they are the adductors. So action of both these muscles, they are the adduction of the. So this is the how we do the, whenever a question of the muscles come of the larynx, we have to explain these 10 muscles in detail. Now out of all these muscles, the ninth muscle is very special, that is the transverse arytenoideus. Number one specialty, this is the only unpaired muscle. All other muscles, there are two, right and left, but this is the single muscle. Number two specialty, it has got dual nerve supply. Dual nerve supply means two nerves they supply it. One is the internal laryngeal nerve, other is the recurrent laryngeal nerve. So it enjoys two of the nerves, motor nerves, M4M muscular. So that you have to remember. Anybody asks you the specialty of the transverse arytenoideus and other specialty of the special muscle of safety muscle, that is the posterior cricoid arytenoideus, that you have to remember. So this is how we have done the muscles of the larynx along with the action. Now comes their nerve supply, or nerve supply of the whole of the larynx as a whole.